ADHD is something that I worked on from the beginning of my career. I was an intern back then, and the effects of reboxetine was observed, and in that time actually this impairment or this disorder was questioned whether it was a problem with regards to diagnosis. I mean, I didn't know that there was a diagnostic problem in the beginning, and then I understood that it wasn't a problem when I was on child psychiatry service, because the clinics were adjacent to one another. The adult and the child clinic, and 4 out of 5 would be diagnosed ADHD, and those coming to the adult clinic, the colleagues would say that we would see ADHD very rare. This was their statement. It was kind of weird. And I understood that in terms of adult ADHD, there is a diagnostic problem. Because you, on one hand, see a very common problem, and on the other hand, there is a rare situation. There is also another side to this story. When it's a child clinic or a pediatric clinic, it's the ADHD, the diagnosis or the prescription is ADHD, but when it's an adult clinic, it's not the same. Represcription or conditioning or the follow-up patients may be the reasons for that, but then again, new cases were not observed in the adult clinic. There may be some reasons to this. Maybe you can add certain things to this list, but ignorance might be one point. I mean, ignoring such cases, or maybe thinking that this is exaggerated. It could be an overlapping condition with ADHD. It could be a problem of definition. I don't exist, it says. The Santa Claus says, I don't exist. It's like maybe a Santa Claus story, but in different platforms there were those experts that claimed that it was a Santa Claus story. And ADHD is not actually something to be diagnosed in the adult clinic. So ADHD starts before the age of 7, and there is shortcoming in terms of concentration, and there are certain shortcomings with regards to impulsivity and so forth. 5% is the prevalence of ADHD, and the same is 3% for adolescents. Simon and friends made the study, and 2.5% is the adult ADHD prevalence. In another meta-analysis, it is 4.4%, the adult ADHD prevalence. These are the studies all around the world. Different methods have been used. We have ACRS, Attila Turgay, DSM, Mini. Those tools can be used in small studies. I use Attila Turan, and then I use DSI to ascertain the diagnosis. ACRS might be more practical in other cases. Anyway, when you look at these percentages, the prevalence goes from 1% to 6-7%. But in terms of psychiatrists, I mean, you may think that this is not a rare condition. This is a study we did in Sivas, in the province of Sivas, door-to-door analysis, and we reached to 900 people, and 2.7% is the prevalence of ADHD. This is adult prevalence, by the way. Again, epidemiological data for SIVAS. There are those that state that this is an exaggerated definition, or it is like a Santa Claus story. This is for those people. As you can see that Sivas, the province of Sivas, contributed a lot to epidemiological studies. There are other disorders like panic disorder, OCD, schizophrenia, attempt to suicide, systemic disorder. And when you look at all the prevalence rates, you see that adult ADHD is the highest. It is 2.7%. And for example, BAB is 0.8%. OCD is 2.6%. You might suggest that maybe the study is not done on the same population, so these are not valid results. You might criticize me for that, but it's not like that, because statistically, socioculturally, we have made certain categorization, and statistics show us these categorization, and based on the data we go to those districts, and the probability of visiting the same regions and same streets is very high, and even maybe the same families. And when we look at university students, the prevalence of ADHD is 4 to 15%. This is the meta-analysis data. This is another study we did. European Journal of Psychiatry published this study, and we wanted to see the students, university students, ADHD prevalence. And after the clinical interviews we made, 6.1% of the university students had ADHD. And this was Cumhuriyet University, and we also carried out other studies here in this university, like eating disorders, migraine, social phobia, and I also brought along the data pertaining to that. That is 9.4%. This is the social phobia prevalence, and again it shows that adult ADHD is not also rare. There is a metaphor, and this metaphor is same in the Chinese stories or in Mesnevi, for example. And when in a dark room an elephant is brought along, and they are asked, in this dark room the people are asked, what does this look like? And then they say that it's like a carpet, it's like a pipe, it's like on and on. So it's like that actually, because there are certain challenges that avoid us diagnosing this phenomena. And maybe a symptom can also be a symptom for another disease. This is the reason for misdiagnosing or underdiagnosing this condition. Let's look at the symptoms first. Problems with regards to liabilities due to inattentive mistakes, not planning his work, and always the need to always move, impatience, not being able to listen an entire speech, always need to move, and kind of distress. When we look at ADHD in adult population, hyperactivity and impulsiveness decreases in adult phase, because as the patients become more mature and older, it's not going to manifest itself as it did in the pediatric population. If we look for clinical signs as we do in the pediatric population, we might have certain problems. So yes, in adult population, in terms of the manifestation of ADHD, there is decreased hyperactivity and impulsiveness. again, ADHD here has three indicators: attention deficit, impulsiveness, and hyperactivity. There are similar symptoms in other psychological disorders as well, like passive-aggressive borderline personality disorder, antisocial personality disorder. For example, hyperactivity might be confused with anxiety disorder. This might lead to a misdiagnosis. Difficulty to learn, for example. Sometimes parents want to learn if there is mental retardation, for example, in their children. This might also lead to some misdiagnosis as well. This is another study. We wanted to go to dershanes, the private courses for university entrance exam, and we wanted to see in these 6 university exam courses the anxiety prevalence. Anxiety in itself affects ADHD, and if your patient did not improve with anti-anxiety drugs, then maybe you could rethink your medication. For example, SSRIs were given to a patient. Many anti-anxiety drugs were used, fluoxetine, sertraline, many drugs were used, but still the problems were ongoing. And then the reason why this patient did not respond to anti-anxiety drugs was the fact that the patient had adult ADHD. I'm not going to talk about the treatment itself, but that patient was selected to be the employee of the month in his business place. We just added an ADHD treatment to the antidepressants he was on. This is the puzzle, and we're just seeing a piece of this puzzle. And this is the question I have actually: why aren't we missing the diagnosis of adult ADHD? Maybe we just see one piece of the puzzle. On the pediatric clinic, maybe the colleagues were able to see the entire puzzle, but then again, this psychiatrist next door fails to see the entire puzzle. Or maybe the pediatric ADHD is more obvious in its clinical manifestation, whereas the adult is not. For example, 5 to 12% is the major depression prevalence. Some studies suggested it is 16 to 31%. And when the patient shows up, we can just give him an antidepressant because he has major depression symptoms, but maybe the patient might have ADHD, and if we do not dig into this, we wouldn't know. In adult ADHD patients, we also see other disorders, like anxiety disorders, like performance anxiety, because we also observed performance anxiety in those students that are going to take the university exam, and we have seen that this is the case in that population. It was 59%, another study suggests. Personality disorders in ADHD patients. I am having actually problems with regard to this. I think there are problems in this area. Antisocial personality disorder in Gata hospital, we do come across with these cases. Antidepressants and antipsychotics may help here, but if the patient has ADHD, these will not help, and there is a comorbidity of 12% to 27%. Again, borderline personality disorder 9 to 14%, passive-aggressive personality disorder 6 to 18%. Here, these are comorbidities, and how these comorbidities may change from childhood to adulthood. Here you see anxiety disorders, behavioral disorders, ADHD, and these are more common in the pediatric population, where other problems are more common in the adult population. By the way, there's a problem of perception. When you go to ER, and if there is pain in the chest area, and if you show up in the ER, of course they would dig for MI, because missing an MI could be fatal. This is, I think, a perception issue, by the way. There are certain academic problems as well. Those that have ADHD might have lower scores. The parents may say that, will it make a difference to prescribe this drug? And I say to them whether it would change anything for them to make 3 questions correct. 3 more questions correct. There are those children or students, adolescents, that take radical decisions with swift mood change that cannot continue their education. So there was this case, and I had this patient, and the thesis teacher gave him one more chance, and then thanks to this treatment, he completed his thesis. He graduated from the postgraduate program. He was just about to actually quit the school, but now, thanks to ADHD treatment, he's going to probably become a civil servant. So if you do not treat ADHD, they cannot academically perform themselves. There are certain problems, at home as well. Family therapists know this, especially they should go for adult ADHD, because impulsiveness is really an important problem, and antisocial personality disorder or personality disorder is diagnosed, but actually it is ADHD. In traffic, again, they cannot stand traffic. They just define themselves as they cannot stop accelerating, or they just cannot stop, for example, and they are so impatient in traffic. These are the words of the patients, by the way. So problems with regards to diagnosis, I think there is a great problem here. It says before the age of 12, it is the DSM criteria. We're talking about primary school here, and what do we expect from a primary school student or a secondary school student? Actually, you have come to the end of your speech. Okay, so I'm finishing in a minute. So high school is much more influential here, because I called the parents and the diagnosis changed. And the mother, for example, talked to me about the ADHD symptoms. If P is 0.05, is it too much, or is P value is 0.55, is it ADHD, or it is 49%, is it it's not ADHD? I don't know. So statistics do not explain all the time those things. Thank you very much for your patience. Thank you very much.